Cancer is listed among top 3 killer diseases in Kenya. Statistics indicate that 33,000 people die annually as a result of the disease. Cancer Survivors of Kenya Secretary Jane Francis Angalia, who has been battling with breast cancer for almost a decade, says that many cancer patients die as they are forced to forgo treatment owing to the high cost of accessing healthcare.
To control it, they have to do another 18 sessions, and at that time they were paying 300 per sessions, over and above the 3 million I was selling for chemo, radiation and surgery. So 18 sessions times 300,000. Imagine. So most of them do 1 or 2 and they stop.
She is now calling on the government to come up with initiatives that focus on lifting the burden of cost incurred by cancer patients, especially at this time that the country is facing an economic downturn.
Personally, according to me, cancer is worse. You know, people are thinking corona is worse. For me, because of what I've gone through and what I've seen so many others going through, it's even worse.
She also says that the mismanagement of the National Hospital Insurance Fund affects many cancer patients who depend on it to cater for the cost of their treatment, and is calling on the government to intervene.
As for NHIF, because that's the only body that I really feel can be able to help cancer patients, I have no idea. I don't know what to say. Because every day we are reading bad things about the NHIF. We don't know the money that we contribute, where it goes, because definitely, of course, we read in the papers, it's eaten. People need to have a conscience.
At the same time, the Kenya Association of Radiologists signed a deal with General Electric Company aimed at providing world-class technology and equipment for cancer treatment and diagnosis, as well as providing adequate training of professionals.
It is very useful because many times as a specialist, when you want to get further education, you have to go abroad, you have visa limitations, you have cost implications, there's a barrier of access to even attending these fora. So a setup where GE can utilize its networks to bring in international speakers allows a larger pool of local radiologists to learn from world-class diagnosticians.
Accurate diagnosis is a result of quality imaging services done with quality technology and competent healthcare professionals.
Meanwhile, a group of youths within Homa Bay County have formulated a plan to help the elderly and people living with disabilities stay at home and be safe in the wake of the outbreak of coronavirus. The group, operating under the umbrella Unseen Hands, will be working with well-wishers who have donated their motorcycles to be used to ferry essential goods at the doorsteps of these vulnerable groups.
It's voluntary, actually. We decided to contribute some little money within ourselves. Then again, we have got people who have given us the free bicycles. Other people have even donated to us. Someone gave us a vehicle if we need, because so far they are staying at home and they don't need these bicycles.
For Channel 1 News, I'm Safin Acheng Oma.